All right, welcome to the next lecture in the program this evening. We're going to be talking about return to sport and activity after concussion. Dr. Russell Camhi, primary care sports medicine physician with Northwell, and I have the pleasure of working alongside one of our athletic trainers. Emily, you can introduce yourself, please.
Hi, I'm Emily Chadwick. I've been with Northwell for the past year. I'm happy to be here.
All right. So we're going to address a couple things going on with concussion. So we're going to define what it is, just so we're all working with the same diagnosis and definition. We're going to go over kind of the two pillars of concussion recovery, which are physical and mental rest. We're going to talk about return to play protocol, how to progress somebody through, when to hold it, and when to refer a patient who's not improving along the expected time course. So just to review some basic definitions related to concussion. So traumatic brain injury is any force that's applied either directly to the head or the body that results into some sort of impact between the brain and the skull. So some of these are high velocity, construction site accidents, motor vehicle accidents, things of that nature. For the most part in our realm, it's sport-related concussion, which has to do with what we call mild traumatic brain injury. So even kind of the worst sport-related concussion is still, for the most part, considered mild because there's not actual brain damage. This is a kind of functional deficit where you get what we say is a myriad of symptoms. So some sort of head impact followed by persisting symptoms, and it can last anywhere from seconds to days, weeks, or even sometimes months. The two types of head impact are what we call coup and contra coup. So coup means you're kind of hit in the front, whether it's a ball or a helmet, and you have injury to the front part of your brain. Contra coup is the whiplash injury where you kind of slide forward and the brain slides in the skull, causing impact on the opposite side. That can also be sometimes with a tackle or a fall from a height, such as going for a slam dunk with a basketball. When you fall down and you kind of whip your head backwards, sometimes you get impact on the front and the back side of the brain when it hits the skull. So you get kind of two types of injuries. And then just to review, second impact syndrome. This is why we have return to play protocol. We want to avoid any episode where you're having basically a head impact while you're still recovering from a concussion. When you get hit in the arm or you get bruised, they kind of add 1 + 1. Whereas when you get increased pressure in the brain, it could be exponential in terms of severity of the injury or illness. So these are things that we worry about. Kind of get back to basics of what is a concussion. So again, a blow to the head, face, neck, or anywhere on the body. It's a rapid onset of short-lived impairment. And again, it is a functional disturbance. It's not a structural brain injury. So basically, I use this kind of image of the telephone wires. So after a bad storm or an earthquake, you might see kind of wires kind of hanging down and kind of not nice and taut. So you can see how the signal would not go quickly across. So that's why people lose power and there's slowed internet and connectivity and those types of things. It's the same issue with concussion where the small nerves in the brain and those pathways that are supposed to act very, very quickly are slowed down. So that's why you get that kind of feeling in a fog, difficulty concentrating, and the other symptoms or signs that are associated with concussion. So my athlete was diagnosed with concussion. How do we return them to sports and activities? So we're going to kind of go through the phases. The two main categories, again, are physical rest and mental rest. In regards to physical rest, I think we all know don't put the athlete back in sport, but there's different aspects that we need to address with different aged athletes. When we're talking about young kids, certainly we want to avoid sports and gym, but you also have to remind them that you don't want to have any aggressive play. Some of these kids are 7, 10, 12 years old, especially young boys, and with brothers at home, I should know I have 3 young boys, they get after it pretty rough, and sometimes there's a lot of roughhousing. So you have to advise the parents to really watch out for that. That can sometimes be more of a risk than just going to practice and doing some stick work if they're a hockey player of some kind. In adults and children, you want to just tell them you can do low-level exercise, walking, taking the family dog for a walk, things like that. We just want to avoid anything where we're building up pressure in our head, so burpees, push-ups, pull-ups, things like that, or any heavy exertional activity where they're huffing, puffing, and sweating. That's usually too much during concussion recovery. And then in young kids, You have to advise them to kind of avoid any environment with lots of kids and low supervision. Fortunately, with COVID, that's not really a problem right now, unfortunately. But with normal times, you want to avoid birthday parties. When it's the holiday season, if there are going to be a lot of cousins getting together, you don't want a lot of kids in the basement without and a kid with a concussion hanging out, because eventually it turns into some rough play or things can happen where they get hit in the head. Now, most of our athletes are young, active, very healthy people. They're used to being active and doing their regular exercise. We found if you take someone like that and you make them sit in their room or in a dark room or do no activity, it actually takes them longer to get better. So we focus on active recovery to help shorten the duration of their symptoms. Simple things like going for a walk, taking the family dog for a walk, getting on a stationary bike at very low level, again, not huffing, puffing, or sweating. These are things that can make them feel normal, that can allow them to do some exercise without exacerbating their symptoms. So the key is to tell them to stay below symptom threshold, below the point where headaches, dizziness, or difficulty concentrating ensue. Again, if they're a high-level athlete, kicking a ball or having a baseball catch is not difficult for them. It doesn't take much mental concentration. So it's okay to do that to make them feel a little bit normal. Now there's the mental side of things. This is where a lot of people it's a little bit more confusing. I kind of simplify it. I say, can I do blank activity? So that's school, reading, writing, TV, phone, internet, movies, any type of activity that requires mental exertion. The basic answer is, if it makes your symptoms worse, you have to stop or do less of it. If it doesn't bother you, it's okay to do. Now at the beginning, we want to limit screen time. We want to limit phone time, and we don't want them watching videos and playing video games on their phone where their eyes are moving around very quickly all over the screen. But the idea of no screen time is not very realistic, particularly if they're having symptoms for 7, 10, 14 days, and especially in today's current environment of remote learning. You can't tell them not to go on a screen, then they can't go to school. There are certain things that might exacerbate symptoms more. So that's cell phone use, iPad use, computers, and first-person shooter video games, and in particular with our older adolescents, driving. You know, we all underestimate how much mental activity is required with driving, especially in a 17-year-old who just learned how to do it. It takes a lot of concentration. So you really want to kind of lower down the exertion on the mental side of things. We want to have active recovery, so you want to have a return to learn program. In general, you want to limit time out of school to no more than 3 days. You want to at least get them back for part-time, half days, or in our current environment, some remote learning so that they can do some work. They may not be able to spend 8 hours on the computer, but some level is what we're going for. And again, you have to tailor that learning in terms of what they're struggling with. And that's where school accommodations come in from the physician side. We can offer all sorts of notes and limitations. So I can do 1 test per day, untimed tests, things like that. But in general, the focus is return to a full day at school, then completion of homework. They want to get back to some regular test taking, and then we can get into any sort of extracurricular activities, whether it's religious school, PSAT or SAT prep, music lessons, anything that might take a little bit more exertion. And now we're going to kind of focus on return to play, and I'm going to tag in Emily to kind of take us into this next part.
Thanks, Dr. Camhi. All right, so we have a return to play. So the question is when do I come back for a reevaluation? So when you go back for a reevaluation, the patient needs to be symptom-free for at least 24 hours. On top of that, we like to say that they're symptom-free 24 hours with a full day of school. Usually can take about a week. Sometimes kids can take longer, sometimes can take shorter. When the child is fully able to commit to a full day of school and no symptoms are being exerted, and they're also on no medications, so no Tylenol or Advil, it's very important. Those would mask any symptoms that we're looking for, particularly headache, which is one of the more common ones for concussion. When they're able to do those things, then you should make another appointment to follow up with your treating physician for the concussion. At which point the doctor will allow you to continue on. All right, so when we continue and start our return to play protocol, there's a couple things I want to start with and I talk with my athletes about particularly. I talk about their diet, hydration, their stress levels, their sleeping patterns, and such things like that. It's a really important thing to touch base on these topics to start their protocol with them so they can try to avoid having any things in their life that may potentially cause headaches, dizziness, nausea, any concussion symptoms. Throughout the return to play protocol, they are going to be exerting themselves. So we want to try to limit that possibility that something else is going to cause a symptom. So continuing on, when you start the protocol, it's also very important to know your particular athlete. It's important to know the history of how many concussions they've had. If they're a student and they've had multiple concussions, sometimes the protocol is going to take a little bit longer. If they also have a history of headaches and migraines, ADHD, depression, anxiety, it can actually take a little bit longer. Well, some of my anxiety kids, they come in, they're very nervous, they can actually have an upset stomach for the first time they're seeing me because they don't know what to expect. If I know they're coming in with anxiety, I like to tell them everything as much as possible to give them a full layout of what the protocol is to try to ease them so that they can be most comfortable so we can have success with a return to play protocol. So with the return to play protocol, this is a great example here. The idea is that we want to stress the body slightly, see how the body responds, stress a little bit more, see how the body responds, make sure we don't have any symptoms, and continuing that process each day, increasing the stress a little bit more. So with the day one, you have obviously symptom-free. So we always start with protocol day 2. So, which is light exercise, aerobic exercise, and we advance from there. So you can advance the slide, Camhi. Okay, so while we're going through these protocols, it's really important to know when to hold a protocol. So when you're stressing the athletes, it's very important to explain to them how they're going to self-monitor their symptoms. You should have a conversation with them about what symptoms they exhibited when they first got hurt, whether it was headache, dizziness, nausea, they had sensitivity to light. It's really important that they're aware of these things, so as you go through the protocol day by day, they can be self-aware and report anything. If at any point in time that they announce that they have some sort of symptom, you need to halt the protocol immediately, stop, let them be symptom-free for 24 hours, and then restart that level. It's really important to do this because if they're exhibiting these symptoms, that means their body's not ready to continue on with the protocol. That means they're not recovered from the concussion, and obviously it's going to be unsafe to continue. All right, so now we're going to go over a little case study, and as we're going through the case study, we're going to discuss the different protocols days that we go through for a return to play protocol. So we have a 15-year-old wrestler that was in an away wrestling match that got hurt. He hit his head on the mat. He exhibited headache, dizziness, nausea, sensitive to light. The coach called me after the injury and after he was checked out by the opposing athletic trainer. I then referred them to Dr. Camhi. So go to the next slide. So upon exam, he was diagnosed with a concussion. Sorry, lost my spot. He was diagnosed with a concussion. He was taken out of gym, sports, academics. He was out of school for 2 days. He had then 2 days of a weekend and then returned to school. He returned to school with full days. He had tests. He had no symptoms beyond that first day. He followed up with Dr. Camhi 2 weeks later and then was able to exhibit no symptoms, so he was cleared to return to play protocol. So the following time I saw him was on Monday. He came to the athletic training room. I sat him down and had a discussion with him about what the definition of a concussion was, what the signs and symptoms are, how he was going to self-monitor them, and we had the talk about diet, nutrition, and things like that, telling him that you need to be good about doing all of these external things to try to prevent any external things to cause potential concussion symptoms, i.e. headache, dizziness, anything like that. We discussed how if he was hydrated, it can cause a headache, and if he didn't eat food, he could get nauseous. So he understood going into the protocol that he was going to be good, do these things, and we could progress with the protocol. So day 1, it's actually day 2 of the protocol. He comes in, we have him hop on a stationary bike for 10 minutes. After the stationary bike, we do a little bit of balancing, a little bit of push-ups and planks. The idea behind this day 2 of the protocol is that you want to start to increase the heart rate to about 70% of your max, and you want to try to lessen the ability to concentrate. So you want to do very simple activities. You just want to work on the heart rate and not try to move their head around too much. Thank you. So then the Tuesday came around, he came in, stated he had no symptoms. So we started with day 2 protocol. So with day 3 protocol, it's on Tuesday, sorry. So on the day 3 of the protocol, you want to start to include your increased heart rate, and also you want to start involving more concentration exercises. So we started on a treadmill jogging for 10 minutes. Once he completed the 10 minutes of jogging, he stated he had a headache. So at that moment, we halted the day. We had a discussion if he had to drink water, make sure he was eating. I said, self-monitor your symptoms tonight, follow up with me tomorrow. So that brings us to the following day, on Wednesday. He stated he had a headache for about an hour. Then the symptoms resolved. He did go to school the next day. He participated in all school activities for that morning, that full day, and he said he felt really good. So he felt comfortable with trying the stage again. So we tried the treadmill once again, and after the 10 minutes of jogging, he once again stated that he had a headache. So at this point, he had 2 attempts on a certain stage. Therefore, we halted the stage. At that point, I got in touch with his parents, and then I referred him back to Dr. Camhi.
So when he came back into the office, at that point, I see him for follow-up. We reviewed the return to play protocol and where he hit his 2 failures, and then we kind of reassessed the exam. So at that point, when I kind of check what we call vestibular ocular testing, it's kind of looking at the tracking of the eyes and how they move together. There were some failures on those tests. When we did I do the balance error score system in my office. That's a quick, easy test that you can use in the athletic training room. He also had significant errors on that. He did not have any horizontal or vertical nystagmus. That's when the eyes are kind of shaking. So instead of them moving, they're kind of having little hiccups. That's a sign of sometimes more intracranial or cranial nerve injury. And he did not have a positive Romberg, which again would be a sign of possible cranial nerve injury of the inner ear and balance issues. But with some slight positive testing and the failure to progress, at that point it's appropriate to send him for vestibular therapy to work on these deficits. So he went to vestibular therapy a couple times a week with a home exercise program. He did that for about 2 months. And again, he was avoiding physical activity, but was attending school during this time. He did follow up and he was asymptomatic once again. And then we restarted him on the return to play protocol, sending him back to Emily, the athletic trainer.
Okay, so once again, the patient came back to me on luckily a Monday. We started the protocol. We had that discussion yet again about what a concussion was, what symptoms to look out for, making sure that he was doing all the right things outside of school and doing the protocol so we could have the most success. So we are on day 2 of the protocol. So we did the stationary biking again, push-ups, planks, and a little single leg balance. So he completed that, was symptom-free, and then I told him to self-monitor, follow up with me the next day. So we got to day 3 of the protocol. Then we tried the treadmill running, and we successfully passed that with no symptoms. So we got to move on from there. Once again, with day 3 protocol, you want to start moving them more, start with a little more concentration exercises and head moving exercises. So I had them do some sit-ups along with push-ups, but also included a functional reach. So that's, as you can see with the picture, you're going down, so it's increasing the different levels. We did sit-ups, which definitely makes your head go up and down a lot, so that increased blood pressure. We also did an aerobic quick step where he was went up, up, down, down on an aerobic step for a timed period. We concluded that. Once again, no symptoms. We were finally able to get past protocol day 3. So day 4 of the protocol, he comes in. Day 4 is when you start wanting to really kind of be sport specific. You want to start ramping up the intensity of the workouts, but you still want to keep them in a nice bubble where they cannot get hit in the head. So a lot of ideas is that they can start trying to do some team warm-ups potentially, as long as they're, the coach is very closely watching them, you're watching them, making sure that it's kind of clear that they're not going to run into another athlete, but they're able to interact with them so they can start thinking about what they need to do. So at this point, we had passed several months, so we have now worked our way into baseball season. So for baseball season, we started getting them ready to do some outfielding. So we did some ground balling for 10 minutes. We did an agility ladder workout for 10 minutes and really try to get his heart rate up and trying to get his concentration moving. We were able to complete the whole workout. He had no symptoms, so we progressed on. So we came in for the 5th day of the protocol. He said, I have no symptoms. He felt good. So we were able to actually let him compete in full practice with no restrictions. So at this point, we're really trying to push him into an area where he has the ability or potential to get hurt, but be confident in participating in practice. Once again, he checked in with me, made sure he had no symptoms, went home. We came to protocol day 6. This is kind of the release day. He felt great. We always want to check in on this last day, making sure they're still feeling great after the really intense workout. So it's really important to have that final day, and you can successfully graduate them from the return to play protocol. So in summary, we want to bring up that both physical and mental rest is largely important early on phase of concussion. Also important is that you need to educate your patient on things like diet, nutrition, and potential triggers when going through the protocol to educate them so they can try to be successful in this. Also knowing your patient's history, so knowing if they have a history of concussions or anything like anxiety or ADHD, so you can get them through. And then also recognizing when you need to halt a protocol and when to refer. That far we can make our kids nice and safe. Thank you.
We'll be available during the panel discussion for any questions that you guys might have. Thank you so much.